Hello, my name is Mara Lopez, and I'm the Director of Marketing for Gateway Community Health Center, and we're celebrating National Health Center Week. With us today, we have our Chief Medical Officer, Dr. Mery Cortes. Dr. Cortes, thank you so much for being with us today.
Hi, Mara. Good morning. Thank you for having me.
Absolutely, absolutely. Doctora, could you please talk to us about the importance of National Health Center Week?
So it's a really important celebration for all the community. It put us on the loop for all our social media and our patients in our community that to let them know that we're here for them, right? And also for our staff and our providers and the front staff, um, having to celebrate them because they're doing an amazing job. So it's a great celebration to have.
And do you feel that during this unprecedented time of COVID-19 that we're really able to celebrate our heroes, and everyone working at community health centers across the nation are heroes right now? So do you feel like we're able to celebrate them?
Definitely, it's a perfect moment. We're going through these rough times, but we are doing our best. Everybody has been so optimistic and putting the best effort to be here for the patients that they're in need. There's a lot of questions. They have a lot of anxiety and yeah, doubts about this pandemic. So everybody in the clinic has been putting their best effort to help the patients. So it's
Absolutely.
a great celebration.
Absolutely, I agree with you. And could you please speak to, we're talking about community health centers. What is a community health center and what does that mean?
So we are here for the whole community. We take care of everybody in the city, in the community, disregarding the ability to pay, right? If they can pay or if they have insurance or not. So the community health center is the place to go for these patients for healthcare, right? And to do preventive care and to take care of their problems. So we have here not only the doctor or the nurse practitioner, but we also have dental appointments. We have the pharmacy. We have other services. And for example, here at Gateway, we have the promotoras, the health promoters for the diabetes classes. So we are not only seeing the patient in one way, but we have different ways to help them. Also, the counselors that in this moment they're so important. Every time they're important, but right now they're so needed.
And during these COVID times, how has our care for patients changed? Are we offering any new services that we maybe didn't offer before?
Yes, so we had to change our operations a little bit, right? At the beginning, there was a lot of hesitancy from the patients to come in. So now that we are allowed, we are offering telehealth, telemedicine visits. So it will be through video or phone calls, and the patients are liking it because they don't want to come to the clinic; they're afraid. So we have that option for the patient.
That's wonderful. But do patients need to be afraid to come to the clinic?
Definitely not. And we have been trying to educate them. We are taking all the precautions to avoid any contacts with between the sick and the health. The patients are not allowed to come into the clinic before they screened, and they're not in the same waiting area. They have to wait outside on their cars, and they will be called in. So there's a lot of the precautions. We are having all the personal protective equipment in the clinics. We're wearing our mask, so there's no risk for them to be in contact with any of the COVID patients.
Thank you. And doctor, usually we hear of chief medical officers and we hear of a doctor sitting in their office overseeing all the other doctors and providers, but you actually practice. Could you explain how important it is to have a relation, to establish a relationship with a doctor, with a provider?
Yes, so I have the best of both worlds, I will say. I have to see the administrative part and understand how the centers work, but then I come here and apply it to my patients and I can offer them all the services that we have available, right? it's really important to have a primary care physician and have that safety net when you have a problem. So the patient can come here, they have their PCP, and then you can help them with the other services. So having to see both parts, I can see the point of view of the providers and the patients, but also the administrative part. So it's a great combination.
Absolutely. And I know that as an internist, you see primarily adults, but could you please also talk to us about the importance of establishing for parents a relationship with the pediatrician? National Immunization Week is this week also. So could you talk to us about that, please?
Yes. Vaccines. So they're really important. We talk about every visit about vaccinations. We push for them. It protects our kids and for them not to be sick in the future, right? So yes, the parents need to bring their kids to their pediatrician for the annual exam, for the vaccines. Right now, they're not going back to school for now, only online, but at some point they're going to go back. And also, it's not only for schools. We have to be protected in general against diseases. So definitely super important. We have the vaccines available here in the clinic, everything that they need. So they will live with all the vaccines. And a reminder to come back for the second dose.
And I would imagine growth tracking is very important too, to see that, to make sure that your child is progressing and growing and hitting all those
Developing.
milestones.
Correct. And also we do preventive medicine here, right? And so if we see something abnormal or that is something that is going towards the disease, we're gonna educate the patients and the parents for to avoid that problem in the future. So definitely, they need to come for their annual exam.
All right. Well, Doctora Cortes, thank you so much for your time. Happy National Health Center Week. We celebrate you and your heart of service, and I'm sure we'll
Thank
be
you.
seeing you around. Thank you so much.
Thank you, Mara. Have a good one.